All right, Patrick, you're on the record. Patrick Bocco, thank you so much for being with us on ITV Gold. You are representing Cry America, a beautiful nonprofit today. I hope you're doing well.
Yes, thank you, Aditi. It's a pleasure to be with you and your audience.
Of course, Patrick, just starting this interview, I have to ask you, Cry America truly, empowers one of the most vulnerable communities of India and all across as well. With the implications of COVID-19 attached to our community and our life right now, what is happening in terms of your programs with Cry America? And, what has been the impact of COVID-19 on these children, on these communities that Cry supports?
Yeah, Cry America, COVID-19 has been a major impact to our fundraising so far, because a lot of our fundraising for the year is done through in-person, face-to-face events. And here in the United States, that has not been possible, due to the lockdowns and the social distancing that's been in effect to stop the spread of the virus.
Right.
So it has impacted us negatively, greatly. To raise money to continue to support the projects to help children in need.
Definitely. And can we discuss some of these projects right now? So, the audience that may not know about Cry America and all the incredible work it's doing, they sort of understand that these are the programs that we're running, and currently they are the ones that are impacted the most due to the lockdown, due to COVID-19.
Right. Well, Cry America has been in existence in the United States for about 16 years now. Our sister organization, Cry India, has been around for 40 years to help underprivileged and exploited children. So we believe in a holistic approach. We try to make sure kids are protected. They have access to health care, food, nutrition. They are enrolled in school. They are not forced into child labor. We stop child trafficking. We stop child marriage. So basically, to ensure that kids can enjoy a childhood. That's basically what we do.
In terms of COVID-19 and its direct impact on the programs, what have been your biggest struggles, in terms of getting relief and getting what the communities need in India and the US?
Right. Well, here in the U.S., during this pandemic, we're supporting organizations here in the U.S.
Right.
In addition to the organizations in India. No Kids Hungry program here in the U.S. and also Save the Children, are doing fantastic work, because children were not allowed to go to school here in the U.S. So a lot of kids rely on the midday meal at school, like in India too, for their nutritional needs. So we want to ensure that kids get access to food and nutrition every day, and also the learning materials. Not every schools here in the U.S. have Wi-Fi, but a lot of children at home do not have Wi-Fi. So we want to ensure that kids can continue their studies and get the educational materials that they may need to continue. So, and also in India with the lockdown, access to food, access to health care, and also, making sure people are educated on hygiene and sanitation to prevent the disease, and also to stop the spread of the virus. So we're doing a lot of efforts, to ensure there is a lesser impact on the interruption of the daily lives of the children and their families.
Let's talk about these children and these families a little bit more, Patrick, because I was looking through Cry America's website just to see, what is happening across the spectrum. There are multiple packages that Cry is working on in order to give COVID-19 relief to a lot of communities. Could you give us an insight into what these packages are? And, how should someone seek help if they are really in need?
Yeah. Well, a good thing about Cry, and our partner Cry India is we work with organizations on the ground. What villages in Delhi need can be different than villages in Bangalore need. So we work with grassroots organizations who do the assessments of what is needed in that certain geographical area. so we can deliver the items that are needed. So it could be food, it could be, healthcare, whatever is needed in that area. So the people, those grassroots organizations are experts on what the community needs. We always work with the community at different levels. Well, that's one good thing about CRY is we don't go and tell people what they need. We work with them and the government, always parallel with the government to make sure, because they have the infrastructure that's required in order to deliver these services.
Right. How are these children responding to all of the care and packages that have been delivered to them? Have you been able to interact, or the team has been able to interact with the families that are being helped?
Yes, we receive reports on the ground on the impact, not only the physical impact, but also the emotional impact of the children, because this is a disruption in their daily lives. So there is emotional, psychological factors that we have to take into, in regards, not only now, but after this, after the lockdown is lifted,
Yes.
and then as things slowly open up, as we believe in the holistic treatment of children, not just the immediate needs, but also the long-term effects.
Right. Do you know what would happen when we are getting out of the COVID period in terms of the care needed for the children, in terms of their education? How fast would you be back on track with CRY's initiatives?
Yeah, well, I mean, this is a new thing, Aditi. It's a totally new virus, and we're learning things as we're going along. And each region is different, as you see here in the United States. 3 months ago, the New York City area was the epicenter of the epidemic, and other countries it was not impacting. And now it seems to have reversed course. The areas where it wasn't a major impact are now seeing an increase in cases, whereas here in the New York City area, we have the lowest transmission rate in the United States, and also in India too. There are different waves of increase in the virus. So we're monitoring that and being able to react to it as needed. Things open up at different paces and also in different areas. So we're constantly monitoring where we need to send resources and what kind of resources are needed.
Let's talk a little bit about CRY America, because there are so many programs that are being done here to benefit these children and also benefit underprivileged children in this country as well. Talk to me about how the volunteers are working currently, and what has been the focus of these volunteers, because you have so many across the country. What has been their focus throughout this entire time period, and what are their jobs and responsibilities right now in the pandemic?
Right. Since, as I mentioned, a lot of our in-person, on-the-ground events had to be canceled for safety and for public health. So we've had to go to virtual, and do a lot of events virtually. And this past weekend, actually, we did our first in-person event. We did a Bike for CRY event that was launched nationally from coast to coast. And of course, we made sure people took the proper precautions by wearing a face mask or covering and maintaining social distancing and not having a large group. But, so this was our first event on the ground. And I think, besides having these virtual events or maybe an in-person event, you need to keep people engaged. And volunteers want to help out in any, they're so giving of their time and their energy, and they have passion that they want to keep the message alive and saying, even we are, undergoing this pandemic and this crisis, but that children are there's still a need for children. We can't forget them, that they, that they need also health care, that they need nutrition. They need to, if they're not in school, they need to continue to learn. So they do a great job of volunteers of keeping that message alive and fresh among, in their own cities and among their family and friends.
Patrick, since fundraising is such a huge aspect of any charity when we're talking about it, How important then it becomes for the Indian American community or the South Asian community to contribute right now? My question would that be, is there a big need for communities and for viewers to come and support causes of CRY right now?
Yes, there is. The South Asian, the Indian community has been very generous to CRY in giving back. Since a lot of the projects we have come from certain areas in India where people were either born or had lived, so they can identify with those geographical areas, and they like to give back because they understand education is a key to success and also breaks the cycle of poverty and a lot of other, child labor and trafficking and child marriage. So they like to support us since we do ensure lasting change with children, and they are continuing to give and support because they know that need doesn't stop even among COVID, and that's one additional thing to worry about now is making sure that people stay healthy and stay free of COVID. It doesn't stop the other needs that were always there.
Patrick, how has this experience been for you personally? There are so many children, hundreds and thousands of children being helped by CRY right now. You are the fundraising director here. How has this experience, transformed you during this pandemic?
Well, it makes you be flexible and just go with the flow because we've had to change.
Yeah.
We had to cancel 7 fundraising dinners this year. We had to cancel our holy events. We do cricket events. We do so many, in-person events that we rely on to raise money, and we had to postpone it. So we have to come up with new ways to raise that money. We just did a virtual event called Superstar where kids, boys and girls, performed. Either they sang or they danced, and we had celebrity judges judge their performances. And I just did the Bike for CRY, which we'll be doing every month nationally in multiple cities. Is a new thing. So yeah, in some times of crises, sometimes you come up with great new ideas in order to survive. That's what you have to do. You're challenged. Either you can run and hide or try to evolve and change in order to continue the work that we do.
Patrick, how many children have been helped so far?
Yeah, our goal, we've helped more than 100,000 kids so far, and our goal is 350,000 kids. And that's helping them with educational materials, making sure their nutritional needs are met by giving them food, making sure girls get sanitary napkins for their health, hand washing, make sure soaps are available. So we try to, have a holistic approach, how to keep the kids healthy, both mentally, physically, and psychologically.
Definitely. Well, this was great having you here with us on ITV Go, Patrick. I would love for you to give one last message to our audience, perhaps for these kids that we're trying to help.
Yes, I would, ask people to kindly ask them to please visit our website, america.cry.org, and to contribute to any donation is greatly appreciated, and it ensure lasting change in the lives of children.
For sure. Thank you so much.
Thank you, Aditi.